Welcome to Healthy Dose. Learn to repair damage, replace key hormones, and regenerate your body. Get ready to take back control and reclaim your life. Now's the time. Here's your Healthy Dose.
Hey everybody, Doctors Joe and Buzz, back with your Healthy Dose. We've been getting a lot of feedback from listeners and callers on previous shows. I think it's going to be a good topic today, Buzz, to discuss a lot of the therapies or some of the different therapies that we use to help some of the chronic conditions that we see in practice on a daily basis. Just to give a rundown, decompression therapy with laser, tissue grafts containing stem cells, hyaluronic acid, different types of growth factors, laser therapy, pulsed electromagnetic frequency, just to name a few. I think a good place to start, Buzz, is to talk about people who are candidates for some of these types of therapies, why you would need some of these therapies, why the healing process slows down, the inability of the body to use oxygen. But I think a good place to start is just stress. There's a couple of different types of stress, right? People are just familiar with physical stress, workout injuries, injuries from car accidents, but there are two other types of stress, chemical stress. What are in your experience, some of the most significant chemical stresses that can lead to different types of physical conditions that affect joints in the body?
Yeah, we see a lot of, as far as that, just people, what we even eat and drink at this point, society, everyone's in a rush. They're eating fast foods, drinking, one of the worst things you could drink is any type of sugar drink like a Coke or Pepsi or something like that, which, messes up insulin levels, which messes up hormone levels, which causes obesity. I was just having a conversation yesterday. We have a lot of first responders. I know you do too, Joe, in your office, and police, firefighters, and these guys have so much emotional stress. It just, really wreaks havoc on their endocrine system, which causes their bodies to break down. And you have these young, like healthy looking individuals just have all these chronic, back pain, knee pain, at a very early age, just due to, the emotional stress, the stress of being a police officer, firefighter, causes them to have endocrine, low testosterone, which causes the body to break down. I mean, we see that quite often, so stress does kill, and you hear that all the time, but that's a true thing.
Yeah. Oftentimes we ask that question to our patients before we make them aware of the chemical and emotional stresses that you touched on. They only think of physical stress, but the body is pretty interesting in that it doesn't matter what the source of stress is, the physical breakdown of the body happens similarly, independent of any of the stressors. So different types of chemical stress, to your point, Buzz, sometimes drinking too much water, not enough water. I see people on paleo diets, vegan type diets now, where they're deficient in electrolytes and missing potassium, sodium from their diet. They're having cramps. It's affecting the central nervous system. It's affecting muscular function. It's producing different types of pain, and emotional stress from work, family, finances, and now you put the COVID into there. Trouble sleeping, poor sleep, the inability of the body to recover. When they enter our office, it's an enlightening thing, an awareness thing, when we're able to bring them up to the point that you have this stress. We're not going to be able to help you necessarily cope with the stress. That's not our job, but we can definitely help maximize the way your body becomes resistant to the stress and starts to gradually improve health.
Yeah. And really the key, I know we both really focus, at least in our facilities, on getting, regenerative medicine, which is really, what is regenerative medicine? It's just getting the body to heal itself. If you're to get an injection or a pill to mask your pain, your clinic or my clinic is probably not the place to go. But if you want to get your body to heal itself, we're like a one-stop shop.
Mm-hmm. What we're getting now too, Buzz, is years ago when we finished school, we started as chiropractic. Both of us took a journey along the way, getting into sports medicine and physical therapy, and then functional medicine and advanced studies in stem cell therapy. People are coming to us asking about these services now. It's not like they haven't tried chiropractic physical therapy and some of these other advanced treatments for knee pain, for example, back pain, for example. So they're coming in with MRIs, labral tears, partial thickness tears of the rotator cuff muscles, desiccation or thinning of the meniscus. And when we make them aware that there's two options to treat a condition that is progressively degenerative, meaning that it's getting worse over time, it won't get better, even with excellent nutrition, sometimes end of state conditions affecting joints. Best case scenario surgically would be surgery to either replace the joint or take out a portion of the cushion that supports the joint, or best case scenario non-surgically may be to use tissue grafts that contain different types of stem cells more than one time. So what do you do? I know you have a heavy focus on knees and shoulders up there, and even doing some spines. What do you do with a patient that has thinned out meniscus? They come to you, they're looking for something that's non-surgical. What's the basic intake and approach to treating this patient?
Yeah, I mean, I think we're on the same page. When someone comes in, always start off with X-rays to see if you can see something, but you really need MRIs when you're dealing with shoulders and knees, because an X-ray doesn't show you what's going on with the soft tissue. It really doesn't show you what's going on with the ligaments, the tendons, the muscular attachments. So, you really have to have that MRI to properly diagnose something like that. And it drives me crazy. You'll have people that'll come in and, they've been suffering pain for years and they've only had an X-ray. And you hear it all the time. Well, I have degenerative joint disease. I mean, what is that? That's such a slang and weak term that, so on X-ray things look thinner, but what's really going on, but getting that MRI tells you the story, it paints the picture and tells you the most effective way to treat it.
Mm-hmm. And in the case of, I was going to, just to your point, Buzz, when those X-rays and those diagnostic tests like the MRIs do come back positive, and the patient either has pain that is limiting them in some capacity, that they're relying on over-the-counter or oftentimes prescription meds that are playing some deleterious effect or having some deleterious effect on their health, where they're developing ulcers or loss of kidney function, their filtration rate is suffering, creatinine levels could be going up because of these meds, let alone the fact that they're further damaging some of the healing cells in their body. If they're having pain or their function is interrupted in some way, but there is something left inside the joint, what's the process? How does somebody prep for a condition like this? What's the actual procedure like, the recovery, and what are some of the expectations?
Yeah, so once you get the MRI back, you got to make sure you don't have a rupture. Like I know you tore your pec a couple years ago. Mm-hmm. You need the MRI to diagnose that. If something's completely ruptured, you're going to have surgery. So but if it's a partial tear or just degeneration, really look at the individual. We like to look at them, from several standpoints. Look at them systemically with their endocrine system and their hormones. If someone has some severe hormone imbalance, their endocrine system is malfunctioning, you're going to need to address that if you want long term. And then short term, if there's a lack of tissue, you can use an allograft that contains stem cells. But you also really need to get, oxygenate that area. You got to, because even stem cells don't work if there's not oxygen. So once you're through puberty, which most of our patients are, that's why those areas, the joints in particular, don't have good circulation post-puberty. Without circulation, there's not oxygen. So even your own stem cells or stem cells that you may put in there aren't going to be able to function properly. And that's when you get into laser therapy, shockwave therapy, PEMF, decompression. These other therapies allow circulation to get to these joints that have very poor circulation and get the body's own stem cells. You put an allograft that contains stem cells in there to work very effectively.
I know, Buzz, in both of our office, we take some conditions that are pretty advanced down the road. The degeneration is significant. And for one reason or another, either because of an underlying cardiovascular condition, because of excessive weight, some of these patients just simply aren't candidates for surgery. So we're not talking about the ones that are surgical emergencies, medical emergencies, but people have the ability to make a decision for themselves, what their tolerance is, what they're risk averse to, and what they're willing to risk in terms of sacrificing a little bit of time, maybe changing their diet and hoping for a good outcome. I know in both of our offices, we've evolved over the years where we're actually doing more dosing of these cells over time for some of the more advanced conditions. Right. So I was explaining to one of our patients this just yesterday. Under no circumstances was I able to convince him that a knee replacement was the best option, although he is a candidate for it. Just simply will not do it. Mm-hmm. So what I mentioned to him is that when we use these tissue grafts that contain stem cells and hyaluronic acid and all these different types of growth factors, and you use different therapies, as you mentioned, to enhance the function, enhance the healing, like oxygen type therapies, within 4 to 6 months, some of the cellular regeneration is starting to take hold. To do a second dose after 6 months, now the first dose, when we're approaching 9, 10, 11, 12 months, it's starting to taper and peak. That second dose that you introduced is starting to peak. And if you do this cycle maybe 3 to 4 times over the period of 2 years, that's the absolute best outcome that somebody can have on mildly damaged or even a severely damaged joint. You've been doing it long enough too to have seen patients that you've treated 3, 4 years ago. Some of the most difficult ones you told me about, some of the power lifters that you've had. Tell me about some of the shoulders and knees that you've treated 3, 4 years ago, because one of the biggest questions we get is how long does it last? But not only that, Buzz, what you use to support, a little bit more in depth about what you're looking for in terms of hormones to optimize the recovery of the patient.
Yeah, so when someone comes in and we'll say that, knees are something that's very common for us both to treat. And I think the reason it's so common is almost anybody who's had a meniscus surgery, knee surgery in the past, at some point is going to need to either have a knee replacement or allograft stem cell procedure. Because when they go in there and they take out that meniscus, even a little piece of it, you lose cushioning and structural support. Mm-hmm. So, and then what happens, usually right after the surgery, you're fine. But then as you get older and your hormonal system decreases, you have decreased testosterone, decreased estrogen, you don't have what they call osteoblastic activity, which is activity that continues to help your cartilage and bone grow. And that area just degenerates. So we get amazing results, just like you do, Joe, when you put the allograft that contains stem cells in there to add cushioning and structural support. You're basically adding tissue to that area. But if someone has low testosterone or a female's postmenopausal and has no estrogen, you're not going to get any bone or cartilage growth, right? They're compromised. So they're really, if they want that thing to last long term, they're going to need to address their hormonal or endocrine system too. If not, then they're going to have to be, getting allografts every 6 months, like you said, So, but if you want them to last longer and you address the hormonal deficiencies, I've had people that have had severe knee damage. We've done one allograft procedure and they haven't come back for 5 years. Mm-hmm. And I've had other people come back in 6 months, and a lot of time that's due to hormonal insufficiencies. Obesity is another thing you're gonna have to consider. If someone's overweight, obviously a lot of pressure on those joints. I think that's kind of what's unique about our offices. We both offer weight loss programs too, our weight loss facility. No, but any clinic that's going to address physical problems that treats obese people has to have a solution to that, because if you're obese, all your weight-bearing joints are going to wear out quicker. So you have to have a solution for that too. And there's no magic bullet. There's no one procedure that we do. My laser is not going to magically fix you. Allografts aren't going to magically fix you. Hormones won't fix everything. But it's a combination of those therapies, and everyone's combination is different, as it really that can change people's lives.
And I think what's unique and different about our offices is that we always get more information. We have the ability to take these digital x-rays, really get 3-dimensional views of the joints in the office. We both work with cutting-edge MRI facilities that have the best neurodiagnostic radiologists in our respective areas. And we do more than advanced blood work. So we're looking at panels to really map out an individual care plan that's going to work for different people. So the care plan that we give a power lifter is different from Mary, who is 75 years old, that walks her dog, 2 to 3 miles a week. It's specified for each individual patient, which is why we get such great results. It's not cookie cutter.
Yeah, there is no cookie cutter. If anyone out there tells you, come to my office, we're going to inject you with this or do this treatment, it's going to fix everything. That's just not, there is no magic bullets out there. Everyone's an individual. And you really need to, go to a facility that offers, basically I look at it as tools in your toolbox. The more tools you have, the better you are to treat. And we've evolved over time too. We're always getting new equipment. I know you're getting a PEMF machine. I'll probably end up with one too. There's all these things out there. And, people ask, we do a lot of training of other doctors around the country, and they'll say, well, I can't get everything. What's the one best thing? There is no one best thing. Mm-hmm. The one best thing for your injury might not be the best thing for my injury. So it's really having a good knowledge base and being able to look at the individual and then picking which one might work best for them. But at the end of the day, what you have to realize, if you're listening to the show, if you have pain or an injury and you're suffering with degeneration, you have to make a choice. degenerative conditions never get better and they only get worse with time. It's kind of like if this was a dental show and we're talking to people that had cavities that, you know, if you have a cavity, you got to make a choice. You're going to fix the cavity, you're going to pull the tooth and put an artificial one in.
Mm-hmm.
Your joints are the exact same way. The good news is if you're alive, you have the ability to heal. And if you doubt that, if you got cut, with the cut heal. If your cuts heal, then your joints can heal too. They just need help.
And as a patient, if you're sitting out there with back pain, neck pain, knee pain, and shoulder pain, the less disciplined you are, the more treatment you're going to need. And so that's why an office that gives you a multi-specialty approach, using different types of diagnostics, but also using different types of therapies, as we mentioned, like these allograft containing stem cells, pulsed EMF, laser therapy, decompression utilizing laser, pulse wave or shockwave therapy, that's going to be your best bet, or at least your portal of entry. The more and it's like anything else with weight loss. People who count their macros, they know the amount of calories that they're taking in, how much protein, fats, and carbohydrates that they're utilizing. Most likely, are not going to need a medical weight loss program. But be honest with yourself. We get people that are trending high in blood pressure, and they say, well, I'm going to change my routine and change my exercise over the next couple of weeks to get my blood pressure lower naturally. What they have to understand is that more damage is occurring in their body by not lowering their blood pressure. Sometimes medication is necessary. You're saving your kidneys. The amount of pressure that you put on your system by letting a condition evolve over time is worse by trying to fix it yourself. When we're talking about these joint conditions, as you mentioned, Buzz, progression and degeneration is your worst enemy. Time is your worst enemy. The sooner you take advantage and take hold of your health, the better the opportunity you're going to have to heal.
But it's never too late. I'll tell you that. We've had good results. I know you have too, Joe. We have people in their 80s and 90s that come in, you know, and obviously as you get older, the more risky, these surgical procedures are, and we're able to prevent them from having a risky surgery and using, you know, some of these alternative therapies and get amazing results. So it's never too late. That's for sure.
Yep. And
as long as you're alive, if you're dead, we can't help you.
Yep. And all of the therapies that we're mentioning are non-surgical, non-drug. So the majority of people listening out there, if you're mobile and ambulatory, you're a candidate. Now, you had mentioned PEMF, Buzz. I wanted to talk to you a little bit about that. We brought it into the office several times over the last probably 6 months. We had one of the specialists come in and treat some of our patients. Just absolutely amazing results. And PEMF, I know you had some questions about it, Buzz. You wanted to ask me. Let me turn it over to you and see if I can give you a little bit of insight about what it is and how it's worked with our patients.
All right, so what's it stand for? We'll start with there.
So PEMF is pulse electromagnetic frequency. And these are frequencies that exist in the environment naturally. And they pass through the body without impedance. And what impedance means is without interference. In a state where there is not chronic disease or inflammation. If there's chronic disease or inflammation in the body or in a joint in particular, the pulsed electromagnetic frequencies are going to stop and there is going to be some interaction. So the way that I explain it to the patients, how it works is if you have a broken bone and as a result there are different types of chemicals released, prostaglandins that are producing pain, and you take an anti-inflammatory, the anti-inflammatory isn't treating the broken bone, it's treating the result of the broken bone, which is pain and inflammation. Pulsed electromagnetic frequencies are not treating disease, but they're treating the effect of the disease. So if you have a back injury, a shoulder injury, if you have, by the way, I know you were doing some work on this, Buzz, first line in treating traumatic brain injury, post-traumatic stress disorder, traumatic encephalopathy, caused by concussions. When you get on this table that emits these electromagnetic frequencies, the area that you feel it first, and what it feels like almost like a TENS unit that you put on the surface of the skin, but it emanates from inside the body. What you feel first when you're on this table and the electromagnetic frequencies are having an interaction with the body is oftentimes not what you physically feel in terms of your most painful body part. So we've put people on there with knee pain, turn the table on, and the first thing they feel is pain in their shoulder. And what we make everyone understand is that what your brain sees as its priority in terms of sending neural impulse and healing energy is oftentimes different than what you physically feel. And if there's confusion in the body, healing is going to be significantly slowed. So
Right.
the beauty of this is when you do enough of this therapy, you're going to be able to get your brain to see what you physically feel. And in conjunction with other therapies, for example, if it's a back pain patient and you're doing decompression and laser, and you put someone on this table and they feel shoulder pain, eventually when it works its way down to the back, you're treating the cause by doing decompression laser, and you're also treating the end result, which is the excess inflammation and chemical release caused by that disc injury. I mean, the results have been absolutely amazing. There's a book that I'm reading right now. It's called Tools for Health. How Pulse Magnetic Fields Help You, written by William Pollack, MD. And there's a section I want to read to you, Buzz, because it goes in line with everything that we do philosophically in treating patients. And it says that the critical state, a point at which a small change triggers a significant one, and particularly in health, is the tipping point, for example, in which an itchy nose becomes a full-blown head cold, or where one wrong step causes your strained ACL to completely tear. We need to keep our bodies from accumulating these red spots. This requires that we access as many healthcare parlors as possible. Pulse electromagnetic frequency therapy, though a very real option for treating a multitude of conditions, is not a panacea. Nothing will make up for poor nutrition, for example. Likewise, the healthiest person alive may still fall and break a bone. Every day use of whole body pulse electromagnetic frequency system creates a dynamic, resilient cellular environment and can cut down on our body's red spots. One of the most obvious reasons our bodies wear down over time is because of the cumulative effects of stress. Stress reactions are immediate, but recovery takes hours or even days. These frequencies offset the effects before they make the body susceptible to more disease. In addition to stress, the natural aging process constantly threatens our foundation. Cellular turnover slows with aging, and eventually cell division happens more slowly and less efficiently until cells die faster than they can replicate. Cell communication and metabolism slow, energy production wanes, and immune function diminishes. Daily use of the pulse electromagnetic frequency therapy restores neurotransmitters and brain function, increases blood oxygen levels, improves circulation, balances blood pressure, promotes ATP production at the cellular level, and helps to activate the cellular antioxidant defenses throughout the body. It's the explanation that we use with almost every therapy that we have, whether it's using the tissue grafts, whether it's using the laser. The ability to have the body utilize and absorb more oxygen is definitely the key to healing. And you're going to find, Buzz, when you add this into your cocktail, you're going to take your results up to another level. It's been truly amazing.
That's awesome. That's awesome.
Yep.
You know, and something we can also talk about. I know that I was having a conversation yesterday. We both also offer ozone injections, and a lot of people are like, well, what is that? And literally we have ozone generators, and we inject that right into joints as a great way to oxidize or get oxygen to these areas that won't heal. And people ask, you know, aren't you worried about getting an embolism or something like that? Well, they realize there's no nitrogen in ozone, so there is no embolism risk. We've had a friend we've seen actually inject ozone right into an artery in his arm, although I don't recommend it. It's a very safe therapy.
Mm-hmm.
You know, once again, a no drug approach to getting the body to heal itself.
Yep. And what that is, we in fact, we just treated a very high level athlete who had a competition last week that had a pretty significant pec strain. 2 weeks before the competition, was able to complete the competition benching almost 500 pounds. And the explanation I gave to him is why these therapies work. For example, ozone is 3 molecules of oxygen. And when you inject it into a tissue that has a partial tear, there's a lot of extracellular fluid that will accumulate around the tear that prevents oxygen from entering the tissue to repair it. So what the ozone does is when you inject it into that damaged tissue, 2 of the molecules immediately join together to form oxygen, and one of those floating molecules is able to eliminate free radicals and start to decrease significantly the amount of inflammation, the extracellular fluid around the injury site, so that oxygen can immediately enter the tissue. And that's why, you know, the pain decreases so significantly and the healing is enhanced so significantly. When you couple that with things like zinc, trace minerals, sodium bicarb, and different types of B vitamins, something called a Prolozone injection, essentially what you're doing is you're putting all of the nutrients that blood would normally carry, including oxygen, into an injury point for rapid healing to occur.
Yeah, and then what that does is stimulate your body's own stem cells that are probably already there to actually do their job. Because, circling back, we all know stem cells are how you heal, but stem cells without nutrients, without oxygen, are useless. They just sit there.
Mm-hmm.
So by using these different therapies, ozone, prolozone, even laser therapy, through photobiomodulation, own stem cells to actually release their growth factors and heal you, just like a young person.
Yep. Question I got, Buzz, the other day. We often combine some of our allografts that contain stem cells with these Prolozone injections and even PRP. PRP, platelet-rich plasma. It's a therapeutic that's been around for quite some time. It's useful as a combination with these allografts that contain the stem cells. Sometimes as a standalone. What's your explanation of PRP? When do you use it on patients? Age-wise, do you use it as an add-on to the therapies often, or is it just patient-specific?
Yeah, PRP is basically platelet-rich plasma, and I think the layman way to explain that is it's food for your stem cells. It's platelet-rich plasma. My experience, platelet-rich plasma or PRP is very effective in younger people. When I say younger, we'll say 35 and below, because at that point you still have really healthy blood. As you get older, we'll say 35 plus, or if you have any type of metabolic deficiency such as diabetes, the PRP obviously is less effective. So, in our facilities, young people, we use a lot of PRP, basically to help stimulate the body's own stem cells to heal. Once people get above 35, though, there's less stem cells, less of your own stem cells there. That's where you like to use the birth tissue, the allograft that contains stem cells. That really not only adds more stem cells and more tissue to the area, but just seems like it works a lot better in the 35 plus population.
Mm-hmm. Buzz, when I get patients all the time that they'll come in, when I say all the time, at least several times a week, and they've been to other doctors before. They're using different types of birth tissue, sometimes fluid type therapies, but I think one of the misconceptions about the use of tissues that contain stem cells, or these mesenchymal cells in particular, is that when you insert a quantity of this tissue into the body, that there is going to be a rapid replication and growth of stem cells, so much so that the body is going to be fully healthy. It's going to regenerate to the point that it was before it was injured. They're going to regain full function. I think that's one of the disservices that's occurring out there in regenerative medicine is misinformation that's being given to some patients, the selling of false hope.
100%. Yeah, these treatments are not systemic in nature. In the United States, you're not allowed to use any type of stem cell exosome, any of these products. You're not allowed to do it IV. Now, there's providers out there doing it, but the efficacy of that's really not that good. If you do an IV of a stem cell, we know 98% goes immediately to the lungs and gets trapped. So you're really not going to get a systemic effect anyways. But unfortunately, there are providers out there doing it. But I can tell you for using it for local injuries, knee pain, shoulder pain, that extra cushioning and structural support that these are able to provide, along with the stem cells, the long chain hyaluronic acid, there's exosomes, there's cytokines, there's all these other things in this tissue. It's amazing, as a localized treatment for people that have chronic injuries that just aren't getting better.
Mm-hmm. I think one of the Dr. Niemark, I think, was one of the doctors I heard giving a lecture on stem cells, and he gave a really good explanation. And this is the way I explain it to patients too. So you're sitting out there with knee pain and shoulder pain. This is for you. There's a couple of different types of stem cells in the body, different stem cell sources and types. So you have one type of stem cell that circulates in the blood system. They're made up of blood type stem cells, hematopoietic stem cells, and mesenchymal stem cells. They're called circulatory stem cells. But then there's another type of stem cells that exist within tissues of the body. Every organ, every tissue has what's called a tissue-specific stem cell. It's a progenitor stem cell. And we can always manipulate the circulating stem cells to assist the progenitor stem cells, which are the tissues that direct healing inside of a joint, inside of an organ, or inside of a tissue. The thing that what we can control to some degree is educating the patient enough that they make a decision sooner rather than later. Because although we can replenish circulating stem cells to assist with healing, the longer the injury takes place, the more time that passes from the injury, the more progenitor stem cells you're losing. And those progenitor stem cells that line the joint are the ones that actually dictate and direct the care or the recovery of the joint. We're not replacing progenitor stem cells. You can't. But we can assist those by adding a massive amount of tissue that contains some of these other stem cells to support those, to make them stronger, bigger, fatter, add more cushioning to the joint. So really, that's the way that this type of therapy works. Is you're not the stem cell that you're trying to affect is your DNA. It's inside of the joint, and all you can do is support that. And when you have the different types of therapies like we do, the best type of birth tissue that you can use, all of these different types of oxygen therapy like laser and shockwave and pulsed EMF, the transfer of nutrients from the circulating stem cells into the progenitor stem cells makes all the difference. I think that pathway that we educate our patients first in the beginning really gives them a realistic expectation that we're either going to be able to help them so that pain doesn't control their lives the way it did once the injury occurred, but we're also going to be able to help them have a realistic expectation about what type of functional change we're going to get. Because since some of these stem cells have been lost and will never come back, it's imperative to affect a change when you have some of them left that can still give you support for better function. Does that make sense, Buzz?
100%. Yeah. And what you have to realize, if you're suffering with pain, no matter where it's at, pain is inflammation. That means you have inflammation. So that means you have something that's breaking down. And, and that's what degeneration basically is. So the key to getting rid of pain is to slow down or reverse that breaking down of tissue or stop the degeneration. And that's what, really what regenerative medicine and all the therapies we offer in our facilities focuses on. Taking an anti-inflammatory to shut off the pain does nothing to stimulate health. And in many situations, actually slows that healing process down. A very common therapy, which is corticosteroids or steroid injections, are really the worst thing you can do if you want to stop degeneration because it kills stem cells. So although it's a strong anti-inflammatory and you might feel better, you're really hindering and literally stopping that healing process. That's why you're only allowed to get 3 cortisone injections per joint per year. If a doctor would give you 4, it's medical malpractice because of the amount of damage that's done. And that's pretty much a standard treatment at this point. You go to your doctor, you have knee pain, they'll use a corticosteroid injection. That's stopping the whole healing process. So it's really, it just doesn't make sense when you really understand the science behind it. That's why, in our facilities, the pain's a warning sign. Hey, it's a check engine light. It's like you come to the mechanic, hey, my check engine light's on. Instead of just unplugging the bulb, we're going to look at it, why is that check engine light on? And is it something that's fixable without surgery? And in most situations, unless it's a complete rupture, like in your pec, the body can heal itself if given the right tools.
Yep. I think a lot of information that we give out to the patients, at least through these podcasts, can put a person sometimes in a state of uncertainty because they think, well, where do I go? Who do I speak to? I know the process is very streamlined in our offices, and it takes place with the initial contact to our office, where a full health panel is filled out by the patient before they ever enter our office. And sometimes we're able to include or exclude a patient, and sometimes make a recommendation through a phone consult or a Zoom conference before they even come to the office. Because we're not going to waste someone's time or money. If we feel like we can help them, we will. And if we can't, we're going to let them know that right away as well. So that
Right.
full detailed health history is very, very important. Usually people will come to us with x-rays or with MRIs. And if they don't, we can do them in office and usually get a turnaround time of less than a day. We get that information. We're often able to order the blood work on the first visit. So really what a patient can expect within the first week of care is full diagnostics, including x-ray, MRI, and full analysis of their blood panel to be able to navigate them through this maze of regenerative medicine to get them the best results.
You really find out why the body itself, because when you have an injury, you're supposed to heal yourself, and if for some reason you haven't, our job is to figure out why and to handle that.
Mm-hmm. Buzz, what do we do with with a case where someone has had a stem cell quote unquote treatment before. They've used a fat graft, they've used a bone graft, they had some relief, and they want to know if they're a candidate to do it again. How would you approach a case like that with diagnostics? Are they the same thing? Do these fat stem cells, which were used sometime in the past, a lot of these bone marrow transplants or grafts that are used for stem cells, do you find that they're as effective as the birth tissue?
Well, the big difference, it really depends on the person's age. Once again, if someone's going to get what they call an autologous stem cell procedure, which would either be body fat or bone marrow, they're using their body's own stem cells, which is fine in younger people. But if you're dealing with someone who's 50, 60, 70, 80 years old, would you rather have a 50, 60, 70, 80-year old tissue or stem cell put into your body, or a newborn umbilical cord baby stem cell? So the choice is clear. The allografts, which are donated umbilical cord tissue, are superior as you age, over time. So it's kind of the same thing. So if someone is an older person, we definitely like to use the allografts. They're very easy to use. They're from donated umbilical cords, completely safe, have been in use for years now. We've done over 8,000 procedures and never had a side effect whatsoever. But these are superior to using what they consider an autologous or someone's own stem cells, especially as people get older. And then, did they get a result before? And then, what's going on with their endocrine system? Was there a new injury? Really, the key thing I think that we're both saying here is you really got to diagnose, why are you the way you are now? And if you've had a procedure before, why didn't it work?
Yep.
You know what I'm saying? So, is there a hormonal issue? I know that we use a lot of peptides in our office. There's other signaling molecules. If you're alive, your body should heal. So if you have a procedure and you didn't heal, what's the why? That's the question.
When people fly in to see us, from different parts of the country, I know in the Midwest and the Northeast, Buzz, when they come to see you, we're down here in Miami. I usually tell people that they need to dedicate about a week of time from the time that they come to go through, have the ability to do all the diagnostics, apply 1, 2, 3, or multi type treatments to the patients, and then we can manage them remotely, and we often do by Zoom. I know we have patients all over the country, both of us. So what we require of a patient is that they're honest with themselves, honest with us on that intake form, because the more honesty that they have, the level of pain that they have, the level of limitation that they have, really directs the course of care. If someone minimizes an injury, if you're out there and you do have neck pain or shoulder pain and you're a minimizer, it's going to make this process much more difficult, costly, and time consuming in the future. So take action. Our job here as hosts of this podcast is to really give you a healthy dose. It's like a punch in the arm, is to make a decision. We want to give you the right information, not a biased opinion of these things, thinking that some of these therapies work. We know that they work. We've done thousands of them. And whether you come to see us or someone else, make sure that the person is trained and that they have these types of therapies available to you. Because as we said, when you're a patient that has an injury, the more things that are available to you to treat that injury, the better your outcome is going to be, the better expectations that you can have.
Yeah, and be wary if someone promises you it's going to work and they only offer, just stem cell injections or just laser therapy or just decomp. That's be like going to a mechanic and he just had a screwdriver. I mean, it might fix your problem, but you might need a wrench or channel locks or something else to fix it too.
Yep. Just like we brought PEMF in, Buzz, in a couple of weeks, we're going to be talking about a revolutionary type of decompression table that's coming to the office. It completely changes the way we're able to approach severe injuries like Facet syndrome, degenerated discs, bulge disc, prolapse, or herniated disc. So we'll get into a lot more about that. Different types of modalities. Our offices are always changing. To get more information about this, everyone that's listening, click like, subscribe, hit the notification button down below so you can always be up to date with these shows. Buzz, it's been great. I just want to take a note too. I just hit a milestone, had my 50th birthday this week, and really surprised that Buzz was able to come down, and a lot of my other good friends, Mike and Todd and Paul, from all over the country. I really love you guys. Thanks for being here, and hopefully these next 25 years are going to be as good as the first.
Yeah, welcome to the club, right?
Right? Yeah. So I need my healthy dose. I got it today. Hopefully we were able to answer some questions. But like, subscribe, hit the notification button, and we'll see you for episode 36 next week.
Thank you.
Bye.
Thank you for joining us. This has been your Healthy Dose. If you enjoyed today's show, hit that like and subscribe button before you go. We appreciate your support. For more information, recaps on previous episodes, and to find out what's next, follow us on Instagram at Healthy Dose Show. Remember, repair, replace, and regenerate. See you next time.